he came back with cauliflower. I was perplexed. I didn't know the evolution of spinach has gone that fast to. So I asked him, I said, what happened to my spinach? He goes, we are out of spinach. I said, why you give me cauliflower? I said, I'm doing you a favor. I had to be careful not to use words I would have used otherwise. I realize this is a young man, but this is an issue we have in Tanzania. We are a service-based country, but we don't know anything about services. So I took the matter to my own hand, opening this company called the Tanzania American Company. And I'm very proud to say my first customer was the Tanzanian Embassy in Washington, D.C. And the reason for that, we've been asked every day to be ambassadors for Tanzania, which need to advertise Tanzania. But if our customers go to the embassy, don't get good service, that's the first port of entry. So I thank you, Mama Mulamula, for allowing me to come and talk about customer service. One of the things we talk about, for an average American, there's no difference between a giraffe in Zimbabwe, Tanzania, or Kenya. It doesn't matter. The difference is the service you provide to that customer. So we need to be aware of this. In researching for this program for the embassy, we learned that government agencies across the globe, they rank poorly in customer service. They have monopoly in many services, including passport issuance, marriage certificate, DMV, driver's license. But I took it personally because this is Tanzania. I want to represent it the way it should be. And if all the embassies in Africa and DC, they're performing poor, we need to move the Tanzanian embassy above them. This is the reason I went to talk to them. We talk a number of things. We're going to continue to do this, and we'll continue to bring this business to fruition. On top of that, we're working with Mr. Singili and the organization to improve the customer service and continuous improvement. Dada Farida, where are you? You had poor service. I got you back. You need to talk to me. Lastly, before you stood up last night and you said you don't like to be associated with failure. If any organization within your jurisdiction have a problem with service, I need to talk to them. And finally, most of you don't think you're in business, but everyone here in a business. Either you're buying or selling. Remember one thing. If you don't take care of your customers, your competitors will. Have a good day.
Karibuni sana. My name is Dr. Liongai Mbilini. Even though I am a DICOTA secretary, and I'm proud to be one, for the next hour, my role here is as researcher, scholar, who focuses on violence against women research. And I'm very happy and honored to be moderating this session. This year, when we were planning the convention, we really listened to the diasporans in America. We did feedback surveys from the last several conventions and asking about what's working well and what can we improve in. And one of the things we heard and we agreed is that as much as we do want to hear from our government officials in Tanzania, let's also let them know about what we're doing so they can be proud of all the skills that we have amongst us, and also so we can have a better conversation about how we can have an impact on our country. I'm very proud of this program, not only because I was directly in charge of developing it with a team of several members, but because, as you've noticed, I hope, we've really reflected that feedback that we've received. It's about empowering the diasporans in the US while making bridges with Tanzania. We've had a mix of that on pretty much all the panels. In addition to the focus on, I guess I'm getting too close, on empowering, I'm not touching it, I'm getting too close. In addition to focusing on empowering diasporans in America, this year we also had another emphasis that is even personal to me, and that's about empowering women and children. This is the first time that we have a panel on women and children and health, and I'm so happy for that. And as you've noticed since yesterday, through all the panels, whether it's about investment, whatever the topic is, I hope you've noticed we've had more women than we've ever had across all the panels. So without further ado, because we do not have that much time and we are trying to catch up, right now I'm going to introduce our panelists. And I've asked them to please only take about 7 minutes to present on your organization or project and focus on highlights. What are the take-home messages you want people to take with them? After this convention, our work is not done, those of us who are planning it. We have more work, and that is putting together proceedings. We have detailed proceedings of the last 3 conventions, and we're going to be continuing with that tradition. That's why the rapporteurs table, when we're all together, is very busy. Wengine wana type, wengine wanaandika kwa mikono, because we put together a big book, over 200 pages every time. And that includes, for the most part, the presenters' presentations. If you have handouts, if you have other information you want to share, we'll include it. So today, on these panels, we just ask you to focus on what are the take-home messages. You can do a quick overview, but detailed overview, people can read at their leisure after, when they go on vacation after this convention, or another time. So I'll be holding them to that 7 minutes, and for the panelists, I will be giving you a 2-minute little flag, and when you have 30 seconds, it's going to say wrap, and then that means just try to wrap it up. Again, even if you didn't finish what you wanted to say, there'll be chances to do that, because we are going to have networking later, and there's going to be detailed proceedings as well. Karibuni sana. I will just quickly introduce the panelists, and then they'll get started. First, we'll start with Ngara from the Ministry of Health and Social Welfare, who will speak on the current status of maternal and child health in Tanzania. And then we will hear from Tausi Swedi from Childbirth Survival International. Nasor Ali, Kaka Nasor, kwapi? He'll be joining us. He was organizing the Eid festivities this morning, and I hope he'll be able to join us still. Otherwise, we can catch up with him later. Dr. Mingula is here, and he will go after that. Nadasha Nengani is here. Nasor? Where? Oh. Dr. Ningula will speak about healthcare and information. Nasor! Karibu. I'm not sure if Tanzanite ladies made it, but I hope they will be joining us today. And then we have Auntie Matilda Tarimo, who's here representing UWT and C. Karibu, Karibu Dr. Ngara.
Good morning, ladies and gentlemen. All protocols observed. My presentation will be on current status of maternal and child health and private sector engagement in the health sector in Tanzania. My presentation outline will be Tanzania healthcare system, progress towards MDGs, MDG 4 and MDG 5, and key issues, policy, legal frameworks, and strategies on private sector engagement, private sector contribution, public-private models, achievements on partnership, investment opportunities in the health sector. I won't go through all this outline I have mentioned here. I'll go quickly to the Tanzania health service system. How is the Tanzania health system? The Tanzania health system is a decentralized system whereby we have a tertiary level, we have secondary level, and we have the primary level. the primary level, we have dispensaries, health centers, and district hospitals. At the secondary level, we have regional referral hospitals, and at the tertiary level, we have national hospitals and zonal hospitals. And all these levels, we have public and private providers of services. I would like just to say on progress on reduction of child mortality. This is according to the Tanzania Demographic and Health Survey of 1999 to 2010. How is the situation in Tanzania on maternal and child health? On child health, the under 5 mortality rate stands at 81, and we have moved from 147 per 1,000 live births to 81 per 1,000 live births. We are faring well in under 5 mortality, but we are not faring well in newborn and infant mortality. We have reached 26 from 32 per 1,000 live births to 26 for the newborn health and for the newborn death. And for the infants, we have moved from, that is from 1999, we have moved from 99 per 1,000 live births to 51 per 1,000 live births. So you can see that even with UN estimates, we are faring well in under 5 mortality reduction, but we are not faring well in newborn health. We continue with progress on maternal health. On maternal health, according to the Demographic and Health Survey of 1999, we had 770 per 100,000 live births, deaths of women, 770 per 100,000 live births in 1990. And in year 2010, we have reached 454 per 100,000 live births. If you translate it into numbers, it means 7,900 women are dying annually. This is according to the UN estimates of 2012, and the report was released 2013. So you can see the rates, but if you translate it into the real numbers, really there is a lot of women dying during births. 7,900 deaths annually. This is 41% decline in maternal mortality. The Millennium Development Goals target, we are supposed to reach 193 per 100,000 live births when it comes to 2015. We are quite behind schedule, and we don't know if we will realize this, because now we are having 454 per 100,000 live births. So to reach 193 in 1 year, it is just impossible. So we are not faring well in maternal deaths. What are the key issues? Let us see what are the key issues causing all these deaths. Oh, sorry. So 50% of pregnant women deliver in health facilities. Another 50%, they deliver somewhere else. We need to work on this. 43% of pregnant women attend recommended 4 clinic visits, and we have 27% of couples using modern methods of family planning. And we know that when people are using family planning, we can reduce the maternal mortality by 44%. Adolescent pregnancy rate is 116 per 1,000 live births. That is also very high. Neonatal mortality counts for 50% of the infant mortality. So this is the situation. Us as diaspora, we are able now to see the situation, the key issues. We need to see what we can contribute to the reduction of maternal and child health in Tanzania. Other issues are access to quality services. You can see that there is inadequate infrastructure. We are supposed to have a dispensary in each village, but right now, according to Primary Health Service Development Program of 2007 to 2017, we haven't yet realized having a dispensary in each village, whereby people will go and women will be attended. We have inadequate skilled health care providers, and we have availability of equipments, medicines, and supplies. And the referral system is not functioning as it's supposed to function. So we have also, outside the health system, care-seeking behavior also for people. They are waiting for their, for example, a pregnant mother will wait for the husband to come even if he has problems. So care-seeking behavior also is a problem. Inappropriate beliefs and practices and low education levels. Yesterday you heard from our Ambassador Sefue that there is low education levels, that the illiteracy rate is going high. Even with women, it's worse, that there is low education levels. So these are the issues. So us as diaspora, tuangalie jinsi gani ya kuweza kusaidia kupunguza vifo hivi. Labda ni kidogo, muda umekwisha, mwingine mtasoma, lakini there are opportunities in the health sector to invest on the health sector, as we have seen from Dr. Crispin Makula having a dialysis center in Dar es Salaam. So you can be able also to invest in health. And also you can be able to invest in the reduction of maternal and child health, having lots of opportunities in the health sector to invest, because the government is committed and the government is allowing private sector to participate into the health services investment. So my time is over. Sorry, you can read my presentation, and if there are other questions, you can ask me. I'm around. Thank you. Thank you, Sam.
Thank you so much, Dr. Ongara, for laying that foundation for us and letting us know what are the stats, the issues, and what we need to work on. In just a little bit, actually, Tausi is going to be able to kind of pick it up from there and talk about what her organization is doing, especially in the area of neonatal. We're going to be setting up, she's got special video and whatnot going on, so she's not going to go next right now. So I will ask if Nasser Ali can speak to us about Jenga Foundation. Oh, so sorry, real quick, I didn't mention this earlier. We are going to have another guest on the panel from, oh, where is that? Okay. Angela Klimpatrick from 90 for Life. Would you please come up?
Good morning, ladies and gentlemen. Idin Baraka. My name is Nasser Ali Basalama. I'm the founder and director of Jenga Tanzania Foundation. It is an honor to stand here before you to share with you about Jenga. But before I continue, allow me to take this opportunity to recognize a few people who are behind of this amazing project of Jenga. They were with me from the beginning. One of them, she's here, and a few of them, they're outside. They're still working to volunteer some other activities. Auntie Zainab, could you please stand up? That's the other one of the key. the Secretary of Jenga, Dr. Kura, somewhere around. Niwagila Kamugisha, the Treasurer. Dr. Abu Diwani, he's the Director of Education. Dr. Habib Ramadan, he's the Director of Healthcare Education. And Professor Kimario, he's the Director of Healthcare and Equipment side. And David Mushi, the owner of Geeks, the one who received too many awards yesterday, he's Director of IPR, Information Public Relations. As a philosopher said, in order to break the cycle of poverty, you have to educate kids. And I say, the kids to last in a stream of education system, you have to support mother. Mother has to be healthy and productive in order to be able to support kids in education system. That's how we can manage to eliminate poverty, mainly in Tanzania. That is where Jenga comes from. We compile those two major issues together, and we make as one and Jenga's problem. I feel proud to stand here and to share with you about two major projects which Jenga is committed with. Healthcare for women and education for kids. Let me share a little bit with you about education. As we all know, in our country, one of the big struggle or dilemma we have is education material. So we commit ourselves to work with a few professors who are volunteer, local here in the United States, and they are originally from Tanzania, include Professor Julius Nyang'oro and Professor, what's his name, Sebo from Howard University, and other teachers from local Tanzania. Our mission is to compile education material from standard 1 to standard 7 and to transform, to put them in software. When we hand one laptop to the child, we give material from standard 1 to standard 7. That will cut down the cost of education material and will standardize education system in Tanzania, and it is doable. And that's one of our commitment. And our second commitment is in healthcare. Right now, Dr. Habib Ramadan is in Tanzania to implement the first ever project, which we just finished. And this project was conducted with Dr. Habib and Dr. Diwani. We locate malaria diagnosis kit, which is, it can be done in-house by yourself. You don't need to seek for professional or to go to a healthcare center. As the procedure is like when you do the reading of blood sugar. Very simple, very accurate. The accuracy is 95 to 100%. It's better than the material, the equipment we use right now in hospital in Tanzania. Very cheap. It's 50 cents per kit. But our mission is to provide for free, mostly in underprivileged communities in Tanzania. Can we do it? Yes.
Yes, we can.
Yes, we can. That's our mission. And so I don't know about you, but we believe we can do it. When I started this foundation, I told myself, I want to solve the problem. I don't want to kick the problem to tomorrow. I don't want somebody else to come to solve the same problem tomorrow. I want to solve the problem, and I believe I can do it. Our goal is to eliminate and to change the face of malaria in Tanzania, and to build the better education system in our country, and we believe nobody else can do it but us. Thank you for the opportunity. Please support us and be together. Thank you.
Thank you very much, Brother Nasser. And he did that in less than 7 minutes. How about that? And wonderful take-home messages. Jenga is a good example of what we've been talking about. Jenga is a good example of what DICOTA is all about. An example of taking advantage of the expertise among the Tanzanian diasporans in America, in the community organizers, and collaborating with Tanzania. So thank you very much for giving us that wonderful overview of that. Next, I will ask Dr. Ningula, who will speak to us some more on healthcare and information, And I will ask my brother from Tanzania with the fancy Mac to help me put that PowerPoint up, please. Is he still here? Yeah.
Okay, let me begin by saying good morning, ladies and gentlemen, Excellency Ambassador Mulamula, invited guests from Tanzania, and even the guests from here in North Carolina and other states from New York all the way to California. My name is Dr. Patrick Nigula. I teach health services, healthcare management, and information technology at South University in Columbia, South Carolina. Let me begin by talk about the health services systems, particularly in Tanzania. Dr. Miriam Ongala from Ministry of Health, and I think in Social Works, she alluded a couple of the health status that the Tanzanian or United Republic of Tanzania is facing today, such as infant mortality rate, maternal mortality rate, fertility rate, and so many health issues that the Tanzanians are facing today. And she has called for the diasporas to find the measures to correct those issues that they face in Tanzanians today. But one of the issues, or one of the measures that I would highlight it, because I do have a lot of PowerPoint. You know, professors, when they start talking, they'll just continue talking, but I do have only 5 minutes to speak here. I'll talk a little bit about the process, structure, and outcome with respect to the health services, particularly in Tanzania. This is my opinion or suggestions with respect to the healthcare systems in Tanzania. They need to look at structure or the organizations of the healthcare systems, such as the facilities. She's just mentioned about the structures and organizations of the healthcare systems. Tanzania started from the village, district, regional, and referral systems. They need to define the indicators that they can measure and look and see what areas they need to improve with respect to the access to care, quality of care, and in terms of the cost and expenditures of health services in Tanzania. One thing, though, that they have done in Tanzania recently, I'm not going to repeat it, is they improve or change a little bit with respect to including the private sectors. And we do have the financing mechanism now with respect to the programs that they have implemented. But they need to go further, and they need our help in terms of the suggestions, ideas, because if you look at the numbers of the infant mortality rate and maternal rate, it's significant, very high. I'm not going to talk a lot about the health service systems, but I'll touch bases in resource productions. If you look at the far to the right of the block which says resource productions in terms of the workforces, facilities, commodities, and knowledge, and then I'll connected knowledge with an information. I'll just keep going real fast here. In terms of the workforces, the Tanzanian government and the private sectors, what they need to do, they need to partner and collaborate it and find and accelerated programs that will help to reduce the adequacies of the workforces in terms of the physicians, specialists, nurses, medical assistants, and etc. Another thing is they need to integrate the medical care and public health. A good example is what you see today in Africa. We're still struggling with the infectious diseases. And at the same time, you see the trend of chronic disease is continuous going up. So what we need to do is we need to capture the trend. We need to find the measures that will help either to reduce the infectious disease and at the same time to watch the increase of the chronic disease such as cardiovascular disease. And if you see the lifestyles of many of the Tanzanians today has significant change. We need to emphasize in physical activities, balanced diet, and sleep well. We need at least to have 8 hours. Let me let me conclude. Let me conclude in terms of economic support and management, right quick. If you see at the management, the block where it says management in terms of the planning, administration, regulation, and registrations. And Dr. Ongala, let me echo Dr. Ongala. They've done a significant numbers of efforts in terms of the public healthcare strategic planning for 2015, is that correct? Yes. So they have indicated some measures that they will measure there. This is in terms of planning and administrations, things like the governance, democracies, what else? There's so many indicators there, but they need to look at those indicators and shares with the private sectors and find the tools that will be able to reduce in terms of the infant mortality rate, maternal mortality rate, and chronic and infectious disease. Let me conclude. As you see the slides there on those two screens, it shows the continuum of health services. Tanzanians, today, in Tanzanians, what we need to do, we need at least to adapt the continuum of health services as you see there, from the prenatal care or to the palliative care. We need to start looking at health promotions, primary disease preventions, all the way to long-term disease. As you can see, I think yesterday, Ambassador Sefue mentioned that the life expectancies in Tanzanians today is over 61.3, if my numbers are correct. Thank you for listening, and if you do have any questions, I'll be happy to share with you. Thank you again.
Thank you so much, Dr. Ningula, really showing us how both the mixture of improving using of technology to increase efficiency and our own preventative behaviors, us as individuals, what we can do to prevent a lot of these diseases. But combining that efficiency in our own behaviors can really help to save lives. So thank you for those examples. And he will be here later, just like the other panelists, so there'll be a lot of opportunities to continue this conversation. Are we ready for Tausi? Is the video ready? Okay, okay. That will be last but not least. So next, let's maybe shift gears a little bit and hear what some of the women's organizations here in the diaspora have been doing. And I'd like to welcome our very own here in North Carolina, Auntie Matilda, who will be speaking to us about UWT-NC.
Hello, everyone. Her Excellency, all invited guests, delegates, and everyone. My name is Matilda. I'm a North Carolinian local member, and fortunately, I'm the chairperson. I was the chairperson for the Women United here in North Carolina, and we're doing good. In every organization or in everywhere people live, there are some unions, small unions within the big unions. So the women in North Carolina, we decided and so it was a good thing to have a small or our own unity that will bind us together, keep us warm, and understand each other better in case of emergencies, in emotion situations, in happiness, and we have been doing a lot good. we found ourselves that we were meeting in wherever we meet, in situations. Maybe we're not as close enough. You couldn't have a lot of dialogue with each other whenever you are sitting around, but you know, we just go in, do whatever brought us there, and go home. But again, as we initiate and started this union, UWTNC, which we call Umoja wa Wanawake Waishio North Carolina, we have found ourselves being so close together by supporting each other in different situations, in small businesses, and releasing our stress a lot by educating ourselves, being good mothers, good sister in the family, and planning activities that help us release stress. As we find ourselves, we work a lot, and sometimes it's very stressful. So we plan and implement some activities, tea parties, beach trips, visiting each other, and just to have dialogues, to exchange ideas and support each other, you know, educate each other about family issues every time there are some issues. And we found ourselves is helping us a lot. So as diasporas, I encourage you, whenever you are, to establish something like this. We have logistics and rules that we have to follow to keep us strong and keep moving. It has to cost you to get in this union. You have to pay admission fee or registration fee. You have to pay dues. It's a little bit, but it's a commitment that will bind you and keep us moving, because the same cycle, your contribution is going to support you sometimes of emergency when you need us. And you will find people around you all the time. You're not going to stay by yourself, because we are we're too far away from home, where you have your own family a lot to support you whenever things happen to you. So I encourage you to establish something like this, because it's very helpful. And some of the of our members are here, some of right now. If you can stand up so they can identify you. Whoever is here, Joyce, please, you can stand up. And our chair lady this time is gonna be, is Zainab Black. She's the one taking over from me. And for your information, we're now about 6 years old since we established this. Thank you very much for listening. And if you have any question and ideas, we can talk to you about it. Asante sana.
Thank you so much. These women's organizations are so important, not only about empowering women in the areas of business and entrepreneurship, but as those of us who live in the diaspora know, as women and mothers, we don't only we have to go to work, some with 2 jobs, sometimes 3, but you're also the cook. Wendo unapika, unafanya shopping, unafanya laundry, wendo dada watoto. So this organization really is a place for women, in addition to all the other things, to exhale. Asante sana, Auntie. And another women's organization from Washington, D.C., Tano Ladies, karibu dada Asha Nyang'ani.
Kina mama, oye! Oye! Should I say in Swahili? Is there any Swahili challenging? Oh. Kina baba, oye! Good afternoon, ladies and gentlemen. My name is Asha Nyang'ani from Maryland. Today I'll be talking about not specific on the organization, but actually what we do as women in diaspora. When people hear about empowerment, they think it's something so huge as it sounds, but actually it's something very simple. Anybody can do it. And it's simple as sharing information. As one of the presenters yesterday, Dr. Daniel Sembua, did I say it right? Said yesterday, Tanzanians were very good in hosting each other, giving drinks, getting drunk, but we don't give information of how to survive. So it's 5 of us. We live in Maryland. We thought it's a time for us to start something for us as women. Just break the silence of being individuals. So the take-home message here, just remember a bridge. Build a bridge between you and your sister within the same house, same state, then cross the border, go to another state, then go all the way to Tanzania. And I'm so happy to stand here with all these women in this room. I know almost like 80% of women in here, just because we connected together. Women from North Carolina, would you please stand up, please? I'd like to really recognize you all. They drive, every time you call them for anything, they will drive 5 hours, come and support us. So the first time we had event where we had more than 200 women in one room. First of all, we thought it was a joke, but when it happened, it was a bomb, I'm telling you. It was a night of sister-to-sister talk. And of course, we have our mothers. Our mothers, some of mothers are not here, so there's some women recognized mothers. They were there to trash us, you know, mothers. They opened up, they told us the truth. And it was a nice evening. From there, we network. We kind of know each other, discuss what we do, professional. So within our community, we have registered nurses, doctors, accountants, you name it, we have it. And we didn't know all these years. Then we thought it would be better for us to bring entrepreneurs. We have women who does something, either designing clothes or have catering business. So we organized the first event, International Women's Day last year. And we tried to call friends, say, do you know anybody does anything? So we got few of them, but they were very effective. We had designers from here, North Carolina. I can proudly say Nashona was one of them. And Dada Flora, DICOTA, and we had several others from other states. So we met in one room, one night, and they all had time to share what they do. And it was amazing to know we had all that talent within our own diaspora, and we didn't know about it. From there, they start partnering themselves based on what they do. So now we see, I can proudly say, we see some of women working together, doing fashion designing together, or when we have events, we know who to call to cook good food for us, or do fashion show, things like that. So what I'm giving you, I'm asking you as women in diaspora, try to build that bridge among ourselves. And we didn't stop there. We keep on making ourselves available to the federal level, to the state level, that, hey, we are here, women from Tanzania. We want to know what is in your office you can benefit from. So we started engaging with State Department, Governor's Office in Maryland, and we had a very good meetings and get involved with other programs going on. And, oh my God, 7 minutes is not enough. Anyway, I'm trying my best. And the last one is about health. Just reminding ourselves that we as women, we always forget ourselves. We take care of our children, our spouses, but we forget that we need to take care of ourselves too. So when we meet, we try to remind ourselves, hey, you need to check your tatas and your titties, make sure they're okay. So we have very good network of health services, and I'll probably like to recognize Ms. Shangarai, a registered nurse. She has a very good organization known as Nesi Wangu. You can go there and find information, health information in Swahili. So share with your families back home. It's very informative on any health issues. She organized the first free medical health drive in Maryland, where we had I believe 2 doctors from Tanzania, or 1 doctor from Tanzania, and 5 nurses from Tanzania who lives in Maryland. We all met in one room. People were given information about health information. Also, another thing, the Rosemary, my God, this woman here, we WhatsApp with her 24/7. We want to know what can we do as diaspora. And she give us a lot of good feedback. You need to do this, we can help on this and that. So we are still working on it. We didn't let you down. And we were able to secure a mammogram machine last, I believe most people have read about it. This is through organization. The same thing, you meet a woman from Africa, you ask what you do. Oh, I help women with breast cancer. And I'm like, oh, we have survivors in my community. What can you do? And she said, oh, I'll do for mammogram, free mammogram. So we invited this lady in our community. Now we are taking all the ladies from Tanzania who lives in Maryland, Virginia, and DC. They have that access to get free mammogram checkup. She gave us free mammogram, where we gave it to, we're lucky that the first lady was here, Mama Salma Kikwete, who is the advocate of breast in Tanzania. We hand over the machine, and it's on its way to Tanzania. Hopefully by end of this year, it's going to be there, and we believe we will save some, a couple of women's lives. Okay, the last thing. So just remember, bridge, build that bridge. Let's build it, and we can do it. Thank you very much.
Asante sana, kina mama oye. And behind every successful woman is, yes, kwa hiyo kina baba, asanteni, support. Thank you so much. Yeah.
Everything would be possible without our mama. She has been a big support. Anytime we call her, she will be ready to listen to us, support us. Thank you, Mama Balozi.
I am not surprised. I am not surprised, Mama Balozi. Annie, I'm not surprised because we experienced that throughout at the national level too. Thank you for those wonderful examples, Dada Asha, of building bridges not only within our diaspora communities, but crossing states and collaborating together. That is just so beautiful. Even yesterday during the fashion show, we noticed that when there was the models for Ms. Yameke and also Nashona, that they were the same models, and even though the designers are in 2 different states, because of that collaboration you were talking about. So thank you. Next, because this was not pre-planned, but I did agree to invite 90 for Life. We're going to have just 3 minutes because there isn't that much time left. And I'm sorry, oh, there we go. Let me introduce your names. So it's actually going to be a duo show here. I'm going to have Angela Clinpatrick and Lara Flint who are going to share 3 minutes together. Welcome.
I am so excited to be here. I'm Lara Flint, and this is my friend Angela. We're from the Washington, D.C. area as well. I'm here with my friends Angela and Bruno, who are both from Tanzania, and I am so grateful to be here, meeting so many of you and learning a little bit more about them, about their culture, and I would love to go all the way to Tanzania with my 5-year-old son one day, and that is a goal that I have. But I'm hearing a lot here about the importance of education and supporting, and that's what we're here about. I'm here to tell you about a man named Dr. Wallach, and he is a pioneer. He's a researcher, a biomedical researcher who's been doing this for 45 years. And he wrote a book called Dead Doctors Don't Lie. It's a health lecture. This has sold over 200 million copies. It's the most popular health lecture in the world. And he has an interesting background. He was a veterinarian. He grew up on a farm. First, let me go back to that. He grew up on a farm, and he saw his father feeding the animals. He gave them a lot of nutrition, and he always thought that was really interesting, that they didn't take as much nutrition or vitamins as the animals did. And then he became a veterinarian, and he learned, and he worked a lot with exotic animals and farm animals, and he worked with reducing the risk of illness in animals. And they did that through nutrition. And he learned that you could reduce there are nutritional deficiencies, diseases that could be eliminated if you give proper nutrition. So they have animal feed, they have elephant pellets, and they have goat pellets, and they had all different types of pellets when they had all of this nutrition for the animals, and they got rid of these diseases. He saved many exotic animals as well. So he started to think, well, why don't we do this with humans? And so he became a physician. He became trained as a physician, and then he started to apply the research to animals. And he found that across species, that if you have he found that across species, minerals and nutrition are the currency of life. And if you have the proper nutrition, then the body can heal itself. The body is designed to heal itself by God, and it can do what it needs to do. It can maintain itself and it can heal itself. It has what it needs. So he developed these products that can do that. And he's got 2 claims. You probably know how difficult it is to get a health claim through the FDA, but there are 2 health claims. One is that are authorized so far, because he's constantly working on this. But one is about reducing the risk of certain cancers by consuming the trace mineral selenium, and who would ever even know that that was important? And also reducing the risks of cardiovascular heart disease by consuming essential oils, which are primarily the fish oils, and that's something that we were just talking about, was just mentioned, but I'm wrapping up in 30 seconds. We want to share this message. We are all about health. We're about the body, empowering the body to heal itself. He believes that so many diseases are nutritionally based. 900 different diseases are based in nutritional deficiencies. And women, if they are given all the proper nutrition, it reduces the risks of birth defects and all kinds of issues like that with their children. So we thank you so much for listening, and please come and talk to us more. We'd love to partner with you, and thank you so much. Asante-san, is that right? Thank you.
It's my honor to be here, and I'm truly, truly grateful. All I ask is, let's be open. We're all here for one. I believe through this whole experience, this group is the most important, because this group focuses on the core issue of human life. We can have all the money, all the material, but if we do not have good health, healthy mothers, healthy children, what kind of a society are we? Therefore, with our product, I'm hoping that we can take it to my country and other countries as well. So let's be open, let's be responsible for our health. We take responsibility for our health, what we feed our children, what we put in our bodies. Sometimes advance is awesome. However, advance also, we need to look at what we put in our bodies, what we give to our children. So I thank you, and I'm truly honored. Thank you.
Thank you so much, 90 for Life, for that passion about us taking care of our bodies. Our bodies are our temples, women, men, and children. So thank you for that reminder and about your products.
Good afternoon, ladies and gentlemen. Good afternoon, Her Excellency Ambassador. I'm very honored to be part of the DICOTA Convention to present and to wrap up this panel of great presenters. Thank you for the statistics. Thank you for everything, because you just made my presentation a whole lot easier. So I am Tausi Swedi, the co-founder of Childbirth Survival International, which is a nonprofit organization headquartered in Baltimore, Maryland, and it has an office in Tanzania. Now, for purposes of this presentation, I'm just going to talk about work in Tanzania, even though we do work here in the US and also in some other areas. CSI, also known as Childbirth Survival International. Oh, I went so fast. Okay, so I already said that part. CSI focuses to improve health services in marginalized communities around the world. I show you this map because these are the areas where you have high maternal, newborn, and child mortality. Of course, different countries having worse health statistics compared to the others. CSI vision is to grow into a reputable and trusted global organization in the elimination of preventable maternal, newborn, infant, child, and adolescent disability and death. The key word here is preventable, because a majority of these deaths that occur in Tanzania are preventable. Mothers get pregnant, they go to health facilities, they deliver, after delivery, they die. And the reasons of death could be like excess bleeding after birth, it could be an infection, things that are easily preventable. So CSI works to reduce the number of preventable deaths. These are the CSI priorities. We work with pregnant women, we work with newborns, we work with children 0 to 5, improving child survival, and also working with adolescents. This was this year, CSI went to Amana Hospital, and of course, There's no one-man show. CSI works with community members, it works with women, it works with regional officers, with the government as well, with the Ministry of Health. So CSI went to Amana Hospital and provided free childbirth kits, because many women don't go to deliver at health facilities because of the barrier of not having medical supplies, gloves, and all these other things that they need. So CSI went out there and distributed these kits for free. We also gave out life-saving medicines such as oxytocin, which helps prevent excess bleeding after birth. CSI at international events, we want to be seen, we want to be heard, because we are the voice of very many women and children and also adolescents. Our country director was out for the International Day of the Midwife. She herself is a veteran registered nurse midwife. You might know her, Mrs. Stella Mpanda. Very well known, you know her, okay, there you go. Very well known, so she's the country director for CSI in Tanzania. We also visit orphanages, even though it's not it's not a specific priority, but we recognize children in orphanages are just as vulnerable as any other child. So we do have extra activities where we reach out to orphanages and donate clothes, food, or pretty much find out what their needs are and are able to help them in whatever way we can. This was the most exciting one, reaching out to adolescent girls and talking about menstruation. Of course, as you can imagine, all of them were like, what? First, we also went with pads. We gave them pads as well. And of course, it was a very enlightening event, because talking about, wanaita kuvunja ungo, right? Right. It's not something that is spoken about every day. It's not talking about like food and fashion. So many girls get into this phase in their life and they have no idea what it is. And it has also contributed to high school dropout rates. Many girls don't go to school because of this. Many girls don't know how to take care of themselves. Some use papers, some use cloth, some use things that you would not even imagine. So CSI reaches out to adolescents, especially the girl child, to empower her with educational materials. And we also have interactive Q&A sessions. And you can connect with CSI on Facebook, YouTube. I mean, you can see our videos. We have interviews with mothers who've delivered at health facilities, and pretty much the work that we do in Tanzania. Making a difference, collaboration, saving lives. Asha talked about building a bridge. CSI takes that bridge and takes it all the way to Tanzania, to Uganda, to Afghanistan, and all these places, because women are dying, and the causes of death are very, very preventable. Something as easy as a midwife washing her hands. Very simple. Asanteni sana. Of course, like I said, it's not a one-man show. We all need support. We need your help. You can contribute in various ways, and you can learn more of that on our website. And I want to show you something.
Thank you so much, Tausi. Now we're going to put a video of childbirth survival. Thank you for, that good example of not only taking care of mothers in terms of birth and ensuring that the health of the babies being born is saved, that their lives are saved and they're healthy, but also for the babies and the teenagers as well, and taking care of their health throughout that lifespan. So. Thank you so much. We'll take a couple of questions, and then we will introduce another doctor as well. Or why don't we do that real quick? Just if you can introduce, yeah, just an introduction. I'm sorry there's not going to be time for a presentation or of any kind.
I just wanted to welcome you here this weekend. It's wonderful to have you. And I want you to know that we have a great Arusha committee here that partners with the Arusha committee, the Friends of Arusha in Arusha, Tanzania. We've been partnered since 1991, and we're still working, and we actually have a lot of interest in health, and we're trying to help the Friends of Arusha build and furnish a clinic for an area. What's it? Darajambili. So we're in the process of working with you. It's wonderful to see how much is going on. It's such a helpful thing. Thank you so much.
Thank you.
Welcome.
Questions. We can take maybe two.
Mine is not so much of a question, it's a compliment. I remember yesterday Balozi said, Rosemary, you know, you were telling us about Cambodia, but you always come back to America. I am really, really, really amazed, and through the Ministry of Foreign Affairs, I'm available 24/7. I work with Asha, and I'm a person who says, if something it works, it works. If it doesn't, I won't beat around the bush. But I'm very much impressed with the Jenga project. It's very important for what you do, you communicate to us so that we know, because there's a similar project in China, Guangzhou, Mr. John Waimbuza, who is actually looking into putting the syllabus in a tablet made in China. And we are trying to connect him to a local service provider, internet service provider, Tigo, so that, and have them at a very, very low price. Instead of parents buying books, they buy them tablets, so that every child can have access to books available to the Tanzanian syllabus. So it's very, very important when you're having any initiative here in America, just drop an email, a WhatsApp. Me and my staff will try and see what we can do because we are paid for that. It is my job. And you know what I've heard here? It has given me more and more energy on working on diaspora. I was joking to people when it's 5 o'clock in the morning, I look forward to go to work. It's because of this kind of initiatives. Thank you so much. And the diaspora department is there to help you.
Thank you so much for the support. One question, yes?
I'm sorry. We've heard some wonderful presentations. Some of them were truncated. I would have loved to hear what Dr. Ongara has to say, as well as Dr. Nigula.
They will still be around.
Right. The issue I guess I'm asking from both, especially Dr. Ongara, is it seems as if we're not using technology to our advantage as far as collecting data and taking those resources to where they're needed. What is the Ministry of Health and Social Welfare doing as when it comes down to data collection? Because we know that it's very essential in getting those scarce resources at the right place at the right time. And Dr. Nigula seems to have those solutions.
Yeah, thank you very much for that question. Yeah, at the Ministry of Health and Social Welfare in Tanzania, we have a system called the Health Management Information System, and we have DHIS as well. So we are using this through the University of Dar es Salaam Computing Center to generate data from the communities, from the health facilities, to the ministry level. So we have the system. The system is there and it's working.
use that. Let me just echo what Dr. Ongara just said a few minutes ago. I think they do have some solutions, but we need to go further than that. We need